Good afternoon. Welcome back to Common Liberty Podcast. I'm Jeffrey.
I'm Eric.
Welcome. Let's load the clip. Today we're talking about healthcare and related healthcare issues in Erie in the United States. And Eric, we've all had some recent experiences with the healthcare system. And to start, I'm sharing a story about someone I know who visited one of the local hospitals 6 times for hip pain and only requested ibuprofen, intentionally refused OxyContin, more serious pain medication for various personal reasons, but visited, let's call it Hospital A 6 times, just requesting ibuprofen, not trying to seek more serious opiate medication for various reasons. And then after those 6 visits, visited Hospital B, which promptly performed an X-ray and MRI procedure and discovered that he had a broken hip. And so they kept him overnight, and he had same-day surgery the next day. And so now he's had an interesting and eye-opening experience with the American healthcare system. And I know, Eric, you've got some similar stories to share.
Yeah, they definitely haunt my dreams. I have had very similar experiences at Hospital A. There was a point where I had felt something crack inside my head. I went to Hospital A. I told them what kind of pain I was in. They asked me on a scale of 1 to 10. It was the worst pain I was ever in.
10.
10.
Yeah.
It was a 10. And I didn't ask for anything. I didn't push for any drugs except for a triage, and I was labeled a drug seeker immediately. I had nurses coming into my room and telling me, "You're not getting anything," when I hadn't asked for anything. Like over and over again, I had nurses from Hospital A come into my room and tell me, "You're not getting anything." Go to Hospital B, and they usually treat me pretty well.
Sure.
But this seems to be an experience I have been seeing and a lot of people experience on the regular. I know for a fact, doctors tend not to believe Black women the most from the studies that we've seen. And I would like to see, I don't know, I hope we can dive into a little bit of some things that we can maybe do to help prevent this kind of stuff in the future.
Sure. Understanding some of the cultural and linguistic, but especially the financial barriers that we experience in the United States with healthcare. So many other nations, Taiwan, the United Kingdom, France, Israel, they have nationalized healthcare.
Mexico,
Yes.
as of a couple days ago, is getting universal health care.
Right. Viva Scheinbaum.
Viva Scheinbaum.
We are waiting for the day when American citizens can have universal health care. And there's some political consequences for that also. Because of the affordability crisis, many people go to work just so they can have health insurance. But if we had nationalized health insurance, that would probably take away motivation for a certain amount of people to go to work. And of course, that is a direct blow to free market capitalism, in the same way that a general strike would be a blow to free market capitalism. There's a really good source of information about healthcare expenditures. The website is healthsystemtracker.org, and they summarize information from the Centers for Medicare and Medicaid Services. For example, since 2020, retail prescription drugs have grown at a faster rate of purchasing expense than hospital and physician service spending. And so some of that increase began with the pandemic. And since then, we've seen an increase in usage of drugs like Wegovy or Ozempic. And in some cases, that's more healthcare than the quick way of reducing the obesity and other related healthcare issues in the United States. And resorting to medication has its own complications. And likewise, since 1970, healthcare expenses in the United States totaled $74.1 billion. In 2024, that number has risen to $5.28 trillion. Same source of information, healthsystemtracker.org. And so in 2024, healthcare was 18% of the gross domestic product. And therefore, we have to raise questions about how does the cost of health care factor into the affordability crisis that everyday people are seeing? How does it factor in the annual per person spending in 2024 in the United States averaged $15,474. In 1970, that was $353 per person, annual average.
And I've seen constantly every couple days on Facebook, you hear about someone not being able to afford their inhaler and passing away.
Right.
Like, you also see drug companies pushing up the price of essential medication because they know that people are going to be forced to buy it. And they are just going to extort it. Because in the United States, we do not regulate the price of drugs like other countries as well. You know,
it certainly deserves the label medical industrial complex.
Oh, it absolutely deserves it. And I mean, we saw with everything a few years ago with Purdue Pharma.
Right, the Sackler
family. And we saw how they pushed this idea that as soon as the information was coming in that Oxycontin was super addictive and all these patients were addicted, they switched to a strategy of blaming the patient. You know, you can go back and look at all the court records of this. They had to pay settlements that I think they fought against.
Right.
Right. I don't know. I think that's still ongoing, some of it, but
a few years ago, Esquire magazine wrote an excellent investigative journalism article about Purdue Pharma and the Sackler family and the lobbying that was done to alter regulation. And specifically, one example is for a certain number of years, up till about 2010, maybe 2009, sales representatives from pharmaceutical companies were well known to visit providers and hand out freebies, branded clipboards, mugs, stress squeeze balls, frisbees, ink pens, you name it. The merch was there to advertise various prescription drugs. And in the mid-90s, we did begin to see an increase in the diagnoses of attention deficit hyperactivity disorder and a corresponding increase in prescriptions for medications like Adderall.
Oh, yeah, I had a lot of that. I was born in the 90s, early 90s, and it seemed like everyone in my class. But at one point, my teachers even threatened me that they were going to pull me out of the school if I wasn't taking it.
Wow. They were threatening you with medical
because I was
complaints.
having bad experiences on the drugs and my parents wanted to take me off. And my life got a lot better when I got off all those drugs they were prescribing me. But I wasn't the zombie in class anymore. And, you know, I'm sure we'll do an episode here on schooling one day, but we'll leave that one there.
It's a good suggestion. Yeah. Yeah. So these circumstances could even be categorized on the bright side of the healthcare situation in the United States. The dark side of healthcare in the United States is the opioid crisis. And in Erie, Pennsylvania, today is April the 11th, 2026. There's been a sustained effort over the last 15 years to really develop services in Erie to help reduce the effects of the opioid addiction crisis. And there are many organizations in Erie, Pyramid, Gaudenzia, other kinds of addiction recovery facilities such as Snug Harbor that will provide treatment to people who are recovering from the opioid crisis. And so when we mention blaming the patient, there's a vicious cycle there of the diagnostic tools, the sales and pharmaceutical company role, and then the monetization of individuals as patients.
Yeah, I know. I know our county council does take this very seriously as well. I've sat in on a couple finance meetings where they talked about this exact thing, about their programs to increase Narcan being given out to people.
Great example.
Great stuff to actually protect our community while they deal with this issue. We, of course, we shouldn't be victimizing the people who have been subjected to this. Addiction is something that we need to take care of as a community and can come from a lot of different sources. But I would love, a lot of this addiction and mental health, a lot of it plays right back into the affordability crisis we're having and, people looking for an escape, just it.
Eliminating the stigma
Yes.
that's placed upon people who are first and foremost trying to address a healthcare issue, whether it's chronic migraines or seizure disorder or insomnia. And those conditions naturally affect someone's productivity at work. And the type of health insurance that might be available at work then is a cofactor in what kinds of treatment becomes available. And so there is a cycle there that I feel really should be addressed through universal health care. And it would seem that corporate profits would increase.
It would help small businesses a lot.
Small businesses.
Because they would be able to get some of these employees that might have had to go to, evil Amazon or, other large corporations that don't treat them well and actually decrease their quality of life and everything else just so they can get health care.
Right.
And, I keep seeing. Sorry, I lost my whole train of thought. Go ahead.
Well, there's a similar observation for a workplace such as Walmart, where a certain percentage, rather significant percentage of Walmart employees get public assistance.
Yeah.
Whether it's LIHEAP or other rental assistance or food stamps, SNAP.
And there's actually, let me see if I can find it here real quick. The amount of people in Erie that are on these services is high. Where is it?
Are you able to bring up a graphic that shows some of that?
I won't be able to bring up a graphic right now onto the stream. I was more of just looking for the number. But it's somewhere around like 30%, I do believe, of Erie residents. Can't find it here. I'm not going to look forever. But, are working and have to receive these services.
Right.
why are companies like Amazon and Walmart and all these people that can very easily pay their employees have people not being able to live?
Right.
I mean, this is like healthcare is an important part of this. And if we can reduce these burdens on people, we can increase their quality of life.
That's the core, increasing the quality of life for all people. From the same source, the healthcaresystemtracker.org, from 1970 to 1980, average annual per capita growth was 9.3% in the United States. However, in that same time period from 1970 to 1980, the per capita healthcare spending increased 12%. So we see the cost of healthcare outstripping the earning capacity per capita.
Mm-hmm.
And so that means there's a large number of people, maybe 30%, consistent with some of the numbers for Erie County and the city of Erie. There's a large number of people where the change in income is not adequate to the change of healthcare. And the same time period from 1970 to 2024, okay, this is a period in American history where we see the maturation of the boomer generation, the baby boomers, the people born just after World War II.
1945 to 1965, I think.
That's approximately right? 1945, 1965.
Yeah, it's the post World War II babies, right?
Exactly, yes. When the United States enjoyed unparalleled economic expansion, primarily due to the growth of unions, especially trade unions, supporting the industrial base in the United States. And beginning in 1970 and especially continuing in the 1980s, we see this explosive growth in the cost of healthcare. And we have to ask the question, how much of the increase in that cost is associated with the administrative expenses of providing healthcare at a time when there's more and more consolidations of large conglomerate healthcare systems. And so these administrative expenses seem to be passed along to the patient. And we've all heard stories of the $8 bottle of water in a particular hospital. And we also know that hospitals are required by law to provide charity treatment to the community, and that justifies in some ways a nonprofit status for hospitals. But we know that health insurance companies, pharmaceutical companies, are not in business to break even. They're in business to make a profit. And some of that goes towards the research and development of new medicines, new types of treatment that are very crucial. And yet we are still seeing this increased cost, this burden on employers and on individuals.
Honestly, even with research and stuff, I see a lot of times the research is being done by outside groups getting a grant from the US government, and then that group just being able to sell off whatever they made to the highest bidder.
Mm-hmm.
And, you know, I don't want to get too involved because I haven't talked to the people involved, but, you know, it's one of the things that this friend of mine said. They go, this idea that capitalism is what's keeping this research alive.
Mm-hmm.
No, funding is what's keeping this research alive.
Right.
And I think if we are paying for research to develop drugs to help Americans, we should probably get a deal on the drug being made with our research tax dollars.
Mm-hmm. So you mentioned tax dollars, and that's one way of acknowledging that the United States tax code, either for the upper 10% of income earners in the United States, as well as the corporate tax code, is not adequately or accurately playing a role in the funding that our government has to provide services to its citizens. And another meaningful example, you talk about the role of private equity in the healthcare industry. There's a fairly well documented story about Mylan Pharmaceuticals, which had its main production facility based in Morgantown, West Virginia. Mylan Pharmaceuticals at one point was the world's largest manufacturer of generic drugs, the least expensive, okay, on the market. And this included the EpiPen. And so in the early 2000s, there was a lot of discussion about the Affordable Care Act and the cost of the EpiPen as a symbol of the cost of healthcare and the price of that EpiPen going up. And so Mylan Pharmaceutical was founded by a gentleman named Michael Mylan, and it was the kind of family-run organization with headquarters in Pittsburgh, Pennsylvania, but its main manufacturing facility in Morgantown, West Virginia. Even janitors in 1980 who owned stock in Mylan Pharmaceutical could retire with their stock valued in the millions. And it was a family-run organization with the highest manufacturing standards. You know, there were chemists, biochemists researching alternatives to monosodium glutamate, MSG, as a flavoring chemical in foods. So they were doing all kinds of research as well as production of the EpiPen. And so Michael Mylan retired. Mylan Pushkar is the name of the founder of the company. And he's the one whose name is associated with the company, Mylan Pushkar. And so he retired, and the board of directors sought to increase its relationship with the governor of West Virginia, Governor Joe Manchin at the time. His daughter, Heather Bresch, was a member of the board of trustees, the board of directors at Mylan Pharmaceutical. And so, unsurprisingly, Heather Bresch was voted as the chief executive officer of Mylan Pharmaceutical. And some of the board members were very much against this kind of appointment for the clear conflict of interest. And so they required Heather Bresch to get a master's degree in business administration. And lo and behold, not too long later, West Virginia University, at the direction of Governor Joe Manchin, Miss Bresch's father, the governor, Joe Manchin, directed West Virginia University to help his daughter complete the Master's of Business Administration degree. And the transcript of that degree is very complicated. It may have been written in Mayan hieroglyphics. It was very unclear as to whether what actual work was done in the awarding of that degree. But nevertheless, it cemented the relationship between Joe Manchin and Mylan Pharmaceutical. And just a couple years later, after that, Mylan Pharmaceutical was sold to another company, a larger company based in Israel. First, before that, it moved its corporate headquarters from Pittsburgh, Pennsylvania to Ireland. And so the role of private equity, the role of private money in arranging healthcare in the United States can contribute to this increased cost that is passed along to individual patients. And so if we advocate for universal health care in the United States, it's essential that we understand the existing economic relationships because it connects to the affordability crisis.
Yeah, I know with, I guess we should say there are nonprofit hospitals
Mm-hmm.
and there are for-profit hospitals. And where we live, we tend to see a lot of the nonprofit
Right.
uh, variety. But once you get out in the more rural areas, you can start seeing the for-profit ones.
Mm-hmm. Mm-hmm.
And a lot of these hospitals used to be like local community-run hospitals,
Mm-hmm.
and they had the doctors that they saw every year for 20 years, long existing healthcare
Right.
relationships that people felt very happily about.
Mm-hmm.
But then private equity comes in, they start messing up all this stuff, and then they start telling other hospitals, oh, we don't want to give them your information because they're our competitor.
Mm-hmm.
You're like, what? This is healthcare.
Right. Right. And an extension of this issue, especially in Erie County, is the role and response of EMS services, where 911 call centers get an emergency call. Let's say there's a fire at a house on the east side of Erie, and there are potential victims or survivors of smoke inhalation or blunt force trauma damage from a collapsing structure, things like that. And so an ambulance needs to get on the scene very quickly. Having adequate 911 call center response services connected to the EMS companies, emergency medical services, emergency medical technicians, having enough of those healthcare staff. And so healthcare staffing, the availability of the 911 call center staff, the training of the 911 call center staff, the adequate wages, the living wages of these critical emergency personnel, connected to ambulance services being located throughout the county so that a 3-minute out the door response time is realistic and effective for the people in a critical emergency. During the pandemic, this healthcare staff shortage came into great focus for the United States, and the tragedy of people on ventilators and respirators as a result of the COVID-19 pandemic. And how does that affect our healthcare staff and our need to replenish healthcare staff that naturally reach a endpoint in their career, or they reach a certain point in their career where they need to do something different. They need to train differently, acquire different skills. And we see this in Erie with the UPMC Jameson School of Nursing, where UPMC Hammett has secured an excellent space at the Erie Center for Arts and Technology on East 6th and East Avenue. And it's a training facility where existing employees and some applicants for student positions from the general public, they're trained to become a medical assistant. And then they go back to some part of the UPMC Hammett system and they get more specific training to become a central sterile processor, cleaning surgical instruments, or an x-ray technician, a sonogram technician, a phlebotomist, things like that. So there are strategies in place. Also in Erie, LECOM, the Lake Erie College of Osteopathic Medicine, also well known, not just for its college of training people to be doctors of osteopathy, but also to hire people perhaps out of high school, perhaps with some early point in their career, but hiring them into entry-level positions, but then tracking them and then providing training for more responsibility, more technical skill, and then they're able to build the basis of a long-term career. And like you mentioned about mothers building a rapport with pediatricians so that their children get the best health care. This doctor has a long-term relationship with the parents, with the children, and understands the healthcare changes that are going on.
And absolutely. And, it seems like there's three, I don't know. Have you ever seen the three Spider-Man memes and they're all pointing at each other?
Right, right.
It seems like those three people are, the healthcare system, the hospitals, the insurance companies, and then you have the doctors and nurses and medical professionals in another corner, and you have the patients in the third. And
Right, right.
I would love to see us, the medical professionals and the patients, more just the pointing at the hospitals and the insurance companies that are providing, honestly, are not doing some of the job they're supposed to be doing. And, you know, another big thing I went through is reporting. All of this stuff is usually done in-house by the hospital. There's not, and the community doesn't have real access to this data. We can, you know, it's like the police investigating themselves. They're usually going to find that there's no problems in what they did. And we're going to keep bad people in place. I'm not trying to say all medical professionals are evil or anything like that.
Of course.
But, we do need to be able to protect patients when they're at their worst. Patients, people in America do not feel very happy about their health care. There's a certain someone whose name starts with an L, Mr. Luigi, has an approval rating that is astronomical.
Is Luigi Mangioni's approval rating higher than the current president of the United States?
I think it's probably higher than both Democrats and Republicans at the moment.
That's an interesting example because it really gets to the core of frustration that people have with health insurance companies and being denied treatment, even though someone can clearly feel what is wrong with their own body.
And, being denied like the most basic stuff, you hear about wheelchairs being denied for people with no legs. They're going, oh, they're not medically necessary. What?
The concept of an insurance denial for service based on a pre-existing medical condition. And in other countries, that's just called medical history. It's not monetized into the regulations and laws that govern health insurance. And so we have to be aware of what are these regulations? How do these companies operate so that somebody can get a good pair of digital hearing aids? And we come back to the idea of the baby boomer generation and this very large cohort of people who are now in their mid 70s to maybe early 80s and have an increased need for healthcare treatment. For example, something like 85% of men over the age of 75 will have an issue with their prostate. And like colonoscopies beginning at age 50, the prostate gland needs to be checked on a somewhat regular basis depending on family history. And the same is equally true for women who need mammograms and gynecological services at regular intervals. And to be able to access these services in a supportive and therapeutic environment where the question of insurance or monetization isn't going to give somebody the worry about, am I going to put food on the table or am I going to pay a surgery bill? And how do I raise my children to be responsible when it comes to negotiating those decisions?
Healthcare is such a frustrating thing.
So that really also touches on mental health care. The frustration that we feel wanting to help somebody and having limited options available. And in the healthcare insurance system, there's bronze options, silver options, gold options, platinum. we could probably learn a lot from other nations. For example, in Taiwan, somebody can go to a hospital in Taipei, the capital, and the doctor picks up a tablet computer, types in the person's identification, and has complete access to the medical record. That same person can attend a clinic in rural Taiwan, and again, the doctor picks up the tablet computer and types in the identification number, has the exact same access to healthcare information for diagnosing and treatment, and has the exact same access to the medical services to deliver to the patient. And in the United States, we see a dramatic disparity in access to healthcare information and access to healthcare services and access to healthcare funding. And so this contributes to the overall quality of life where many, maybe a few, but it is increasing in number, European nations are referring to the United States as an underdeveloped nation.
Yeah. I mean, I've heard the phrase, we're just 50 third world countries in a trench coat with a Gucci belt.
Gucci's being generous. We give a lot of foreign aid to the nation of Israel in many different ways, and people in Israel have nationalized health care. A woman in Israel can choose to have an abortion and receive that health care in a professional, high-quality setting.
Mm-hmm.
In the United States, women do not have access to that kind of healthcare service. And like you said, about 50 different underdeveloped nations under one trench coat, okay, with some healthcare and some liberty and some justice for some people.
Mm-hmm.
Where private healthcare, somebody who can afford a full body MRI scan, they can access that.
Mm-hmm.
And that doesn't even begin to mention the personal choice for cosmetic surgery.
Mm-hmm.
And it doesn't begin to address the need for access to surgery to correct an ectopic pregnancy.
And I mean, even with cosmetic surgery, you also have a lot of drugs that could be going towards people with the semaglutides.
Mm-hmm.
These could have been going towards people that needed it for diabetes and weight loss and stuff like that. But instead it's going to... South Park had an excellent episode on this, and also navigating the American healthcare system. It's a banger, guys. It's good little jam. But we see, also, I did want to say, while Israeli citizens do have access to healthcare, I highly doubt that is extended to their Palestinian counterparts in the same borders.
Very likely.
Yeah. But, what can be done at a community level to help people? What can a local municipality do, to help stand up for their citizens, fighting these these giant global behemoths of healthcare? I feel... Personally, I've always felt like a health line, basically, where you can call in and talk about what happened. Maybe they direct you to what is it? Health and the
Health and
service.
wellness.
No, the service Christy Genebis runs. I can't.
The Human Relations
The
Commission.
Human Relations Commission. I'm sorry, Christy. But maybe it's directing it to there if there's an issue there.
Hospitals frequently employ social workers that can fulfill that role. And at the same time, there may be limitations to their authority to create a solution. They may be able to recommend a solution, but then where and who is making the decision about what actually gets done. And when you ask that very important question, what can be done locally? The first step, of course, is to raise awareness. And there's plenty of awareness about the opioid crisis.
Mhm.
There's plenty of awareness about the cost of an ambulance ride being something like $6,000. Okay. That is a fact that's worth researching. And does that influence somebody's decision to call an ambulance or to seek a ride from a friend or a relative to the hospital?
Uber is becoming the most popular ambulance service, and drivers, of course, don't want someone like flopping into the back of their car, take me to the hospital, I'm dying. Like,
Right.
that's not, it's putting a lot on an Uber driver, first thing, out of, for nothing. But, we also have seen patient dumping, has been a huge problem. I mean, while I was living in Washington, I had went to seek medical care at a hospital in Olympia, and they pushed me to the bus stop in a wheelchair.
Wow.
For trying to seek mental health services.
What year was that?
That would have been 2017 or 2018.
Okay. So before the pandemic, and what were your symptoms at the time?
I don't want to get into that.
Okay. So you sought treatment, but your attempt to get treatment was essentially rejected, it sounds like.
I was trying to be put into a psychiatric unit because I didn't feel safe. And they told me they didn't have space for me, and I was pretty inconsolable, so they had security put me in a bus, in a wheelchair, and push me to the bus stop.
Wow. Okay.
And
that's terrible.
Oh, I mean, that's just, the thing is this is the reality of healthcare for a lot of people. Like,
yes,
of course, I think what we need to do is we need to have more nurses, more doctors.
Mm-hmm.
We need to reduce this frustration that they are feeling in their workplace, because they're going into work and they're seeing all these problems. And I worry about hospitals and insurance companies using those problems and pushing the blame onto patients.
Mm-hmm.
I think Canada put out a study recently talking about how overweight people are affected by healthcare,
mm-hmm.
and how they
mm-hmm.
don't get treated the same. I had a doctor here in Erie just refused to touch me.
Wow.
He just kept telling me, you're overweight, you're overweight, you're overweight. And I was sitting in the room with my social worker.
Goodness.
And she was like, look, if you touch his knee, you can feel that there's a lump there, and he's
mm-hmm.
concerned about it. And like, it was only at that point that this doctor would even try and, doctor on me, I guess I should say.
So you had an independent witness who could verify your complaint.
Oh, yeah. It's probably sitting in the notes
mm-hmm.
of what had happened. I won't say the doctor's name, but
it sounds like your experience was both typical and atypical. You had a fairly routine need that needed to be addressed, but the thing that made your situation exceptional was this independent observer, this case manager that could confirm your report of pain and discomfort was actually real.
Oh, yeah. I don't go to the doctor by myself anymore. I won't. It's not safe.
Okay. So that's some real world testimony about the effect of treatment in the hospital system and risk management of hospitals and liability insurance and malpractice insurance and what makes medical school so expensive. It is a prestigious profession. However, the salary scale in other nations
much better
is much better according to the cost of living. And one way we can measure this, we talk about the nationalized healthcare in Canada. We talk about the newly nationalized healthcare in Mexico.
Viva Scheinbaum.
Viva Scheinbaum. And yet, we don't see mass numbers of people from Canada coming to the United States for treatment. And we don't hear stories about people from Mexico engaging in medical tourism in the United States. We're hearing about the opposite. We're hearing about Americans who are going to Mexico, to Costa Rica, to seek medical treatment, to Portugal, to Turkey.
To buy EpiPens. I mean, one of the big things that happens in California and along our southwest border is people have got together tours, basically, where they rent a bus that goes to a pharmacy in Tijuana across the border from so people can buy the medication they need to live at an affordable price, because the Mexican government makes sure that that drug is available for that price. And in Mexico, a lot of it's just over the counter too.
Sure.
Which there's a lot to talk about there that I don't think I'm the one qualified, because then you go to countries like Japan and they're like, can't even get Tylenol, right. It's tough. But I have seen this push, to blame patients, for the healthcare system. Overweight people are blamed for why it's too busy. I mean, I had a friend of mine's whose mother, who's an ER nurse, she was saying, like, the only people that come into the ER that don't have something like physically broken, that they can see, are just either fat or on drugs. And that's not a good way. We can't be thinking about patients this way in healthcare, because it creates the bad outcomes that people experience, and it creates this hatred, and this anger. And that kind of gets back to why Mr. Mangione's approval rating is so high. They see every day how their families can't afford medication. Who was it? I think it was Engels. He talked about like social death back in the day, just how, these corporations can contribute to the death of hundreds of thousands of people, but they can't process what they're doing is wrong. It's just...
It raises the question, is our military defense spending and the subsidies for multinational fossil fuel companies indicative of priorities that are inconsistent with the actual needs for the infrastructure, the healthcare of citizens? I think we have to consider that raising awareness is the first step, but overcoming the legislative policy barriers, the regulatory structures that guide healthcare in the United States is a long road before we get to a solution. And other nations have already found, 32 out of 33 other industrialized nations have found that nationalized healthcare, universal healthcare, Medicare for all is a viable solution. So hopefully, Eric, will be able to come back to this topic in a future episode.
Oh, absolutely. I think, I think the topic of the day for the next while is going to be affordability.
Sure.
And I think as we learn and navigate our way through Erie, that's going to change. Like, we're going to learn more and have more to say. So,
right.
But I think that's all for us today. And, Geoff, do you want to close us out?
Well, sure. Thank you, everybody, for joining us today. I'm Jeffrey.
I'm Eric.
Thank you for joining Common Liberty Podcast. Load the clip.
Have a good night, all.